Greetings to all of you, and thank you for always watching the videos that we send out at Meditalks Uganda, where we talk medication. As you know, we are on a journey regarding special considerations about medicines and medications used among the elderly people. Guys who are 60, 65, 70, 80, 90, or even more. We pray that God gives us a long, blessed life. So one of the other things that we want to tell the elderly people, or the things that we want to tell those people who are giving them care, is the issue of maintaining a list of medications that are taken by this elderly person. We already said that they are having multiple disease states, which usually means multiple drugs. By the way, sometimes one condition like hypertension can mean that someone is taking 3 drugs or more. One condition like diabetes can mean someone is taking 2 drugs or more. Now, if they have multiple disease states, it means they are taking very many medications. Taking very many medications means that they could be having adverse drug effects that are also multiplied. In fact, sometimes when they get these adverse drug effects, which sometimes actually present as new symptoms, they may assume that they have a new disease and seek care for this. As if that is not enough, it is almost a common characteristic of very many elderly patients to have a medicine cabinet at home or some kind of medicine tin at home. And this medicine tin may have it may have drugs packaged in wrong packages. Now, this is also something to pay attention to. The same elderly persons usually have a lot of dietary supplements, and they also have a lot of medicinal herbs. Now, if you have this list of drugs, conventional drugs they are taking, the herbal medicines, the dietary supplements, sometimes even over-the-counter medications for their pain, then it is not uncommon to find an elderly person having more than 15 drugs that they are taking. I remember when I was still very young in the career of pharmacy, I assisted one of the researchers in some work that they were doing with the elderly. And this is something I saw with my own eyes. These guys have a lot of drugs. So it is vital that there is a list that is maintained. And this list must be presented to the physician when you go for medical care. It must be presented to the pharmacist as you are getting your drugs from the pharmacy. But also pay particular attention to changes. By changes, what do I mean? Admission, discharge, change of hospital, change of physician, change of the pharmacy where you buy drugs from. Wherever you have these changes, it is important that this list is presented. Otherwise, we risk getting issues of where you get a drug that you're already having at home, which will mean that this elderly person may swallow the same drug more than once. This multiplies the dangers that can come from the drugs. And the dangers can be as simple things which can be managed, or even dangerous things like overdoses and death. So, for very many reasons, this list is quite important. So we encourage you to maintain a list of all the drugs that the elderly person has, including medicinal herbs, but also not forgetting the dietary supplements that may have. And without even the issue of adverse events and adverse drug effects that can come from the drug, keep in mind that swallowing one drug may affect the amount of another drug available in the body. Keep in mind that sometimes if you swallow this drug, you cannot swallow the other. So because of all these reasons, let us have a list of the medications that the elderly people are taking. And this is a very important thing. And thank you for watching, and look out for the next tip when it comes to medication use among the elderly.